Hi people, welcome back to Molecular Biology and Biotechnology with Lucy. If you're new here, remember to hit the subscribe button. I give a shout out to all of us who have worked with me. Thank you so much. So now, AstraZeneca is in Kenya, the COVID-19 vaccine from Oxford University, and already it has been rolled out, and frontline workers, health workers have already been, receiving the vaccination across the country. Yeah, and of course, Kenya has a way of marking history in, like the people in the left side have already named a girl, a child who's just been born around the time that it arrived in Kenya as AstraZeneca, and we wish her well, and I hope that she can, probably mark history with her innovations and development now that she has a trademark name. All the same, the vaccine has been received differently by different people. A majority of us are happy, and now we have a sigh of relief that the pandemic is coming to an end. Others are in denial because of the fear of the adverse reactions and effects of vaccination, which sometimes are unknown. But we also have a group of people who are opposed to vaccination because they feel we were okay, and the pandemic was coming to an end and everything would be fine. But all the same, personally, I am very excited that we have the vaccine, because now this way we have a way of preventing this pandemic now and even for our future generations. Is COVID-19 vaccination safe in pregnancy and for breastfeeding moms? Little is known actually. Although there hasn't been any harmful effects in countries where they have already vaccinated pregnant women, there is insufficient data to actually recommend vaccination in pregnant women, because during the clinical trials of safety, we were not having pregnant women involved there, and therefore the vaccination in pregnancy is only recommended when the risk to COVID-19 is actually higher than the effects of the COVID-19 vaccination. For example, in frontline care workers who are already pregnant, it means that they are highly more exposed to the COVID-19 infection as compared to the adverse effects that could come with the vaccination process. It is also recommended if the pregnant woman has other underlying conditions like hypertension, diabetes, their BMI is too high, and so on. So in that case, because those category of pregnant women are likely to have very severe COVID-19 disease if it actually occurs, which could even lead to preterm babies or stillbirth. Now, if you're trying to get pregnant, then there is no worry of not having the vaccination. You can still do the vaccination and continue with your plan of getting pregnant. And now, if there is a situation where you choose to get the vaccination, then there is no circumstance in which the care provider should tell you to first terminate your pregnancy so that you can avoid any adverse reactions. Above everything, it is important to know that we do not have sufficient safety information concerning vaccination in pregnancy, and therefore it relies solely on you as a pregnant woman. Now, in breastfeeding, there hasn't been any harmful effects when we administer non-live vaccine. And for example, AstraZeneca is a non-live viral vector vaccine, but still no much information is available because breastfeeding moms were also not involved in clinical trials, and therefore in the process again, let the breastfeeding mom choose if they still feel comfortable to do it, considering the adverse reactions that will be outlined by their healthcare provider, and then they are able to choose which direction to go. So that is it. In terms of safety, kindly keep referring to the WHO and CDC guidelines concerning the same. But the beauty is, it is not all doom and gloom. much, guys. See you in our next episode.